South Africa's gas and helium producer Renergen will start production of its helium-powered ultra-cold mobile freezer in the next few days. The company launched its prototype cold chain storage called Cryo-Vacc on Monday. It has a temperature range of -150 degrees Celsius to 8 degrees Celsius and can store vaccines for periods of up to 30 days without the need for any power supply. Renergen CEO Stefano Marani joins me live. Thanks so much for your time on SABC News this afternoon. So how long has Cryo-Vacc been in the making?
It was actually quite a quick process in terms of what we started with and getting it into the development stage. The initial idea came about in the first week of December last year in response to the need for a cold storage device. We had the patents done before the end of the first week of December, and we had a working prototype as little as 7 to 8 weeks after that. So it's been a very rapid deployment of know-how and skills in order to get this thing available.
How is it different to perhaps other cold chain storage facilities?
First and foremost is the hold time. If you're going to move vaccines using, say, dry ice, then you've got 3 days to get them from point A to point B. There are also significant other challenges that you have with dry ice. In particular, the vaccines that are closest to the dry ice may get things like freezer burn, and the ones that are furthest away may defrost, and that may damage the vaccines. The difference that you have with this technology is that the temperature is uniform throughout the entire box, with the result that you don't have a situation with some vaccines going off and others not. The whole time of 30 days means that you can effectively take them out to the field and you can deploy them properly. Yeah, the biggest challenge that you have is, let's say, for instance, you take a box and you fill it up with dry ice and you put, say, 1,000 vials in there, which would be the equivalent of call it 6,000 doses of Pfizer. It takes 15 minutes per dose to be administered, and if you're in an area without electricity, it's a very large challenge to try and administer that many doses in such a short space of time. We give you the flexibility and the ability to be able to roll them out ethically. And then, of course, we've got temperature tracking, we've got GPS monitoring, we've got all of the requisite systems that would be required for full validation along the cold chain custody. So it really is quite a big advancement relative to just the good old traditional dry ice in a box scenario.
Yeah, when I was reading about this, that 30 days without power supply seemed to be quite a uniquely South African consideration when you were making that. Did you think about the challenges that we have with power supply, with Eskom and load shedding when you were designing that?
Not so much about load shedding. I think the bigger concern, because there are freezers that'll keep goods cold for a period of up to 12 hours. So the load shedding isn't that much of a concern. The concern is that if you're let's say, for instance, you're trying to go out on a costing model to try and roll out vaccines in a large scale, and you're basing your model on the cost of transport for a box with 1,000 vials in it, and you're looking at the cost per vial, then I can tell you off the bat right now, you're going to lose 80% of your vials if you're using dry ice, because you're not going to be able to roll them out in time if you have no power on the other side. Okay. And this is the challenge. So we decided, let's come up with a more intelligent solution. Let's think about smaller number of vials per box. Let's think about longer hold times, and that gives the healthcare workers adequate time to be able to roll the vaccines out in a more manageable manner, as opposed to just seeing how many vials we can get into a box with dry ice, which seems to be the way that people are thinking at the moment. And the result is clear. The World Health Organization came out recently and said that up to 40% of all of the vaccines on the planet get spoiled because there's no power on the other side. And we need to start thinking about these issues if we're going to be practical.
Okay. What scale are you planning on manufacturing these Cryo-Vaccs at?
So in terms of where we are, we're manufacturing ready within the next few days. We won't necessarily start manufacturing until we've begun the validation process. So we will commence validation with SAPRA.
What's validation? Sorry.
So validation means that in order for a case to be worthy to be insured for the transport of vaccines, it needs to be validated as doing basically what you claim that it can do, and that's done in conjunction with the relevant health agencies. So we're about to undertake that process, probably starting in the next week to 2 weeks' time, depending on when the slot becomes available, and then we'll know fairly quickly what the characteristics and the dynamics are. By that stage, we will have gotten all of the relevant manufacturing divisions ready to start mass producing, and then it's literally just a case of once the validation has gone through a certain phase, then we expect that we'll be able to start concluding orders and start the manufacture of these cases.
Can I ask, what other technology are you working on or set to release soon, based on how you've said you began the process around December, thinking about how to store vaccines differently and the like? Are there other innovations that you're working on brought on by the coronavirus pandemic?
So brought on by the coronavirus itself, no. I think what we've got over here is a major leap forward in terms of the use of cryogens, and cryogens are basically just gases that are turned into liquids because they're very cold. So there are a lot of different uses for cryogens in general, and in the use of COVID and vaccines in general, I believe that they have a much better place than dry ice does. But just in terms of the nature of our business, the very nature of our business fundamentally is that we drill for gas, and then once the gas comes out the ground, we purify it, we take it down to ultra low temperatures, and then from there we take it to its destination for use. Another big innovation that we had that came here from South Africa that now people internationally are starting to look at quite seriously is one of the gases that we produce from the Free State is natural gas, or methane. We take that down to minus 162 degrees Celsius to turn it from a gas into a liquid. And we run large trucks on methane, and that reduces your carbon footprint by up to 90% relative to diesel. And you also eliminate all of the carcinogenic elements of diesel. But then more importantly, we use this gas and we bring it back up to room temperature before it goes into the truck. But in doing so, it's obviously very cold. And so we use that to provide free cooling for food in the back of the food refrigeration trucks. So there's massive economies of scale that you can achieve by using LNG and these cryogens in everyday life that reduce the need for external power sources of electricity.
Stefano Marani, CEO of Renergen, thanks so much for your time on SABC News this afternoon.
Thank you.